Infectious disease specialist Dr. Zain Chagla joins us with a COVID-19 update. And, months ago, Dr. Chagla, we thought this would all be gone. Now it's come back with a vengeance. The scientific advisory table is saying wastewater data is showing about 120,000 cases in Ontario right now.
Yeah, there's a lot. I mean, again, the benefit here is a lot of people have immunity through their vaccines, that the risk of complications is very low, that we've been trying our best to really get aggressive medications out there to give an extra layer of protection to those who are at the most risk. But it's the time. If you haven't gotten your full series of vaccines, it's the time to get your full series of vaccines. Even though there isn't a mask mandate, it's still important to consider wearing a mask in high-risk indoor settings. But there is going to be a risk of getting COVID, and unfortunately, it's high today, and it will probably be high in the foreseeable future, given that this is a disease we're going to have to live with in the long term.
We are seeing at least hospital numbers going down.
Yeah, and I think that reflects exactly that, right? We have a lot of protection through prior infection and immunization. We have been trying to get Paxlovid and other treatments out to people. It's not been as great as we would like, but certainly the highest risk in many regions have had access. And it's very different now. We hopefully will be able to deal with this wave without a significant amount of healthcare strain. There may be some. But recognizing, again, we have the tools out there to make sure that people have as benign a recovery as possible. They just have to access them when needed.
We're hearing reports that some people are getting COVID again, like they've had it before, they're getting it again. Is this like, when you get a flu, you could get the flu again as well?
Yeah, absolutely. Look, the original variants and the original COVID strains, the Omicron came about in areas of the world where people had only immunity through natural infection. And that's what made Omicron very different. It could reinfect people relatively quickly. And so, again, it's important for people who have gotten infected in the past, who have not received a full series of vaccines, to get a full series of vaccines. It would reduce the risk of getting infected again, reduce the risk of severity from getting an infection again. And so, again, we're going to expect this. People are going to get this multiple times. The virus is going to continue to mutate to be more evasive to the immune system as before. But as long as people, again, are keeping up with their vaccines and again, the immunity that comes from these, they're hopefully going to be more mild episodes as life goes on.
We're hearing reports that some children are getting a rash before they get other symptoms. How common is this? And is this because of that B2 variant, subvariant?
Yeah, it's a little bit strange because there's a lot of viruses circulating now, and there's a lot of reports of COVID being associated with symptoms that it's never been associated with before. So, is it because some of these kids have COVID because the fact that a lot of kids have COVID in the community now? Is it that there's something else different? And this phenomenon, hand, foot, and mouth disease is typically a different virus altogether. Often we never find that virus, but we suspect it's the one that causes symptoms. And so it may just be a red herring that these kids are COVID positive, but actually have the virus that causes hand, foot, and mouth disease. And again, this is where it gets very clouded, especially as more COVID transmits. The other stuff that transmits, people may attribute it to the COVID and again, not necessarily look a little bit deeper.
Okay, we've got about a minute left. We want to talk about the flu because flu cases are on the rise in Hamilton, and so many people. I know I have been getting my flu shot forever. I didn't get one this year, and now I'm like, okay, now I'm afraid.
Yeah, look, it's a time to get one if you haven't. Flu shots are incredibly important. The flu is going to be here. We're seeing very atypical flu seasons in places like Western Europe and in Denmark. They've seen a flu season that kind of came out of nowhere in March, which is very atypical for that place. And so we may see flu go into the summertime, which is a little bit atypical given that we've shifted the cycle so much. And again, important for people to get them protected if they haven't been protected yet. There's still time before the season starts.
Okay, I will make well, you don't even have to make an appointment, right? You can go into most pharmacies to get it. So Dr. Zain Chagla, thank you again for your timely advice.
No problem.